Hi everyone, welcome back to our Facebook live series where we tackle different topics related to breast health, breast cancer, and Komen. I'm Katharina Kang, the Mission Programs Director for Komen North and West Texas. As a reminder, you can catch all of our past videos here on our Facebook page in the video section or on our YouTube channel. Just search for Komen North and West Texas. This month, let's talk about breast health in rural populations. Did you know 1/5 of the U.S. population lives in rural areas, but only 1/10 of all physicians practice in rural areas? Did you know women living in rural areas of the U.S. are screened for breast cancer less often than women in urban areas? According to the CDC, rural areas have lower incidence of cancer than urban areas. Remember, incidence is the number of people who get diagnosed with cancer, but they have higher cancer death rates. Understanding rural-urban disparities in breast cancer diagnosis and treatment is important in efforts to ensure that rural women have the same quality and timely care to fight this disease as women in urban settings. We will discuss two primary issues facing rural populations today: transportation and health insurance. Many rural regions have longer distances between medical facilities and less availability of health services, limiting access to breast cancer screening. According to a 2008 study by Oniga et al., people living in rural towns must travel a median of 83 to 97 minutes before reaching the nearest academic-based healthcare facility. Given the high poverty levels in many rural areas, some patients face financial barriers to transportation, including not having enough money for gas or possibly not having a car. Rural cancer patients who are not able to drive a car lack social support to assist with transportation or lack access to social work services and may simply be unable to receive cancer services. Due to this, many rural states have employed outreach or visiting consulting clinics to increase access to cancer care in rural areas. Through agreements between rural clinics and larger urban practices, specialists travel by mobile units to rural sites for a certain number of days per week or month. These arrangements have lowered median driving times to oncology clinics and increased rates of screening and diagnosis for breast cancer. The next primary issue rural populations face is health insurance. Historically, rural areas have lower proportions of residents covered by employer-sponsored health insurance compared with those living in urban areas. Nearly 2/3 of the rural insured live in states that are not expanding Medicaid at this time. This has left a coverage gap for those who have incomes below 100% of the poverty level, making them ineligible for tax credits, but above their state Medicaid eligibility levels. In terms of treatment, oral chemotherapy, that's chemotherapy medication taken in pill form via the mouth, when available can offer advantages to patients and caregivers, including less frequent visits to a doctor's office or cancer treatment center, less need to schedule long appointments for infusions, and less worry about finding transportation to and from appointments. This flexibility is particularly important for people living in rural areas who otherwise would have to travel long distances to the nearest treatment facility, as well as for employed patients and family members who are trying to reduce hours away from work during treatment. Unfortunately, many health insurance policies do not provide adequate coverage for these newer treatments, and many patients find oral anti-cancer medications impossible to afford. The good news on the oral chemotherapy front is that Komen advocates are working with lawmakers to try to pass something called oral parity. Oral parity requires health insurance plans to ensure that patients being treated for cancer will not have to pay more for an oral medication than one administered by IV. Today, 43 states have enacted bills ensuring oral parity. Komen is here to help knock down the barriers that our rural populations face. In 2012 alone, Komen affiliates across the United States funded more than 1,900 grants totaling more than $92 million to local community organizations. These local organizations provided much needed services, including mammograms, diagnostic services, educational programs, support services, and treatment assistance to address needs and barriers related to breast cancer disparities. Komen, North and West Texas's 91 county service area includes many rural regions that have few medical facilities or health services, limiting access to breast cancer screening and diagnosis. Because of this, our affiliate has made funding rural breast health care programs a priority in our community grants program. Several of our current grants recipients focus on providing support to our rural populations through mobile units and community outreach. If you or someone you know needs a mammogram, please visit our website at KomenNWTX.org or contact our office, and we can put you in touch with any one of our community grantees. We will ask you your county of residence to determine which grantee to connect you with, and then the grantees will ask you a few eligibility questions before making an appointment for a free or low-cost service. Our grantees are proficient in several languages and can assist with setting up appointments with a breast health provider. You can also call the Breast Care Helpline at 1-877-GO-KOMEN, which offers trained multilingual cancer social workers who can navigate patients through the services they need, including the Treatment Assistance Program, which is primarily there to assist those struggling with the financial burden of breast cancer treatment. This month, we are spotlighting Komen scholar Elizabeth Morris. Dr. Morris is the chief of the breast imaging service at Memorial Sloan Kettering Cancer Center, MSKCC, and professor of radiology at the Weill Cornell Medical College and the Larry Norton Endowed Chair. She currently serves as president of the Society of Breast Imaging. A graduate from the University of California, Davis, Dr. Morris received her medical degree from the University of California, San Francisco. She completed her residency at Cornell University Medical College and her breast imaging fellowship at MSKCC. Dr. Morris's research focuses on optimizing the use of newer techniques like magnetic resonance imaging, MRI, to detect breast cancer early and improve the workup of breast lesions, with the goal of finding these lesions when they are small and treatable. Dr. Morris and her colleagues have pioneered high-risk screening with MRI and offers screening with MRI, ultrasound, contrast-enhanced digital mammography, and tomosynthesis. An accomplished clinician scientist, Dr. Morris has published many papers on and spoken at many conferences about breast disease and the use of MRI. Her recent research efforts have involved looking at imaging biomarkers to assess risk and treatment response. You can learn more about Dr. Morris and all of our Komen scholars at komen.org/meetOurScholars. That's it for this month. Thanks for watching, and we'll see you again in December.